Okay. So first I would wash my hands, I would introduce myself, identify the patient with 2 identifiers. So name, date of birth, or wristband. I would provide privacy, explain the procedure. So it's going to be a heart and peripheral vascular assessment. And then I would apply gloves if needed. So do you have a history of congestive heart failure?
No.
And do you have any numbness or tingling in your extremities?
No.
Okay, so first I'm going to do the heart. The first sound I'm going to listen to is the aortic. It is the right sternal border. It is the second intercostal, and it is at the base of the heart. Next is going to be the pulmonic. It is also the second intercostal space. It is also at the base of the heart, and then it is the left sternal border. Third is Erb's point. It is in the third intercostal space. It is also the left sternal border, and then that's where you hear murmurs. Fourth is tricuspid. It is in the fourth intercostal space. It is left sternal border, and then it is at the apex of the heart. And fifth is going to be the mitral. It is midclavicular, also at the apex of the heart, and it is in the fifth intercostal. Okay, there were no murmurs that I heard, and it was a strong heart tone. And so S1 and S2, S1 is at the apex of the heart. S2, well, S1 is the apex, so it would be tricuspid and mitral. And then S2 is at the base of the heart, so it would be pulmonic and aortic, and then Erb's point is where you hear murmurs. So next I'm going to look at her, do her heart rate. So her heart rate, when I was listening to it, it seemed regular. So I'm going to count to 30 and multiply by 2. Her heart rate is 39, so times 2 would be 78. Yeah, 78. And then that is in between the parameters of 60 to 100 for a normal heart rate. It was, the rate and rhythm were both regular and normal. So next I'm going to look at her arms. Okay. Her arms are symmetrically, bilateral symmetrically, and then there are no There is no edema or venous patterning. There's no variation in shape or size as well. So now I'm going to have you squeeze my fingers. Okay. The hand strength is bilateral symmetrically, so that's a good thing. And then I'm going to have you lay down. Oh, and you can put your shirt on, sorry. Okay, looking at her legs, they are bilateral symmetrically. They are tan in color with a pink undertone. There's no ulcers, redness, or edema that I can see. There's no venous patterning at all. And I think that's it. So then we are going to look at lesions. So looking at this one, I do see a mole mid-calf. It's about the size of a pencil eraser. It is round, and there's only one of them. Looking at her other leg, I don't see any moles, but I do see freckles on her legs. They are pinpoint, so very tiny. They're all round, and then they are evenly distributed. She has no secondary lesions like piercings, tattoos, or birthmarks on her legs that I can see. Let me take one more look. Okay. Also, on the legs, I forgot to mention that the hair was evenly distributed. They are shaven legs, but the hair follicles I can see are evenly distributed. So now we're going to look at vascular lesions. So when I was looking at it, I did see a small bruise on her, a small bruise on her thigh. It's about mid-thigh. The edges aren't round, but it's normal for a bruise. It's about the size of a dime, and there's just one of them. So next I'm going to palpate. And palpate the other one. There is no edema present, and they are moisturized thoroughly throughout, no dry patches or anything like that. So next I'm going to palpate for the posterior tibial. It'll be on the inside of her ankle. It is about a +2, a little more on the weaker side, I would say, but it's regular and elastic. And now I'm going to look at her dorsalis pedis, jeez. It's on the top of her foot. That one I would say is more weak, so I'm going to say it's a +1. It is regular and elastic. Next, I'm going to look for ulcerations on her leg. I'll look in between your toes now. Okay, there are no ulcerations on her legs. Do you have any numbness or tingling on your arms or hands?
No.
Do you have any numbness or tingling on your legs or feet?
No.
Okay, so then I would make sure the patient is comfortable, make sure the bed is in the lowest position, make sure items in call light are in reach, side rails up 2 times, and then I would document my findings.